Hi, everybody. Welcome to Better Utah Broadcast. I'm Katie Matheson. I'm the Communications Director here at Alliance for a Better Utah. Remember, we are now obviously officially changed formats to Facebook Live every Wednesday at 12:30 p.m. And every week we're going to have guests on from various organizations, various Utahns, change makers in the state. And with the legislative session here upon us this week, make sure that you're checking back regularly to get updates about our legislative priorities. And be sure when you see that video, that image pop up that we're going to be going live, you can click Get Reminder so that you know when we're going to be going live. So today with me, I have RyLee Curtis, and RyLee is the campaign manager for Utah Decides Healthcare, which is the Medicaid expansion ballot initiative that you've probably signed by now.
Hopefully.
So yeah. Anyway, RyLee, tell us a little bit about yourself.
Hi, everyone. If you have not signed this green packet, this is the Medicaid expansion ballot initiative. We have been working on expanding Medicaid in the state for the past 5 years. We've gotten, really close these last 5 years, getting the Senate to pass it, having our Republican governor, Gary Herbert, pass his own initiative. However, we never got all bodies to support it. And so here we are with a citizens ballot initiative, and I think it's really cool. And I think your viewers should feel very proud to live in a state that this is constitutionally protected for us to go directly to the people and get this passed this way.
That is pretty cool. And this is a big year, as we all probably know, for ballot initiatives. We've got 6 now that are, people are collecting signatures for. So it's an intense year. Yeah. So can you give me a little information about yourself? Why are you doing this? What about you has called you to be interested in healthcare and work on this issue in particular?
Yeah, so I started my degree, finished in 2014 with a Master's of Public Policy at the University of Utah. I am a native Utahn, born and raised, never moved outside of the state. So I care deeply about the policies that impact the people who live here. And when I started out, I was an intern at a nonprofit, and I was collecting stories of people who fell into the Medicaid coverage gap. And this was at the cusp of when the ACA had passed congressionally. So, for me, it was really personal getting to know these stories, getting to know these individuals who fell into the coverage gap. They earned too much money to qualify for Medicaid in the state, and they did not make enough money to qualify for help on the ACA, on Obamacare. Mm-hmm. So for me, I think back to people like Emily and others who actually have lost their lives waiting to get the coverage that they never were able to get because the state never expanded Medicaid. So that's really my drive and why.
Okay, we're back. Sorry, we had technical difficulties. The Wi-Fi cut out. So if you want to donate an Ethernet cord, that would be great. Anyway, as we were saying, we're talking about personal stories, why Medicaid expansion is important. And I had just begun to say that I myself at one time had fallen into the coverage gap. And so to me, it's actually a little bit ironic because a lot of the conversation around the ACA about how it shouldn't be a federal thing, how states should take care of their people, et cetera, et cetera. But it was, in fact, the state that had let me down because we decided not to take Medicaid expansion. So it's a very complicated topic. And I know ABU at one point, I think it was in 2014 before I was here, they planted 300 plus crosses on the Capitol lawn to signify the death of Utahns who had passed away because we chose not to expand Medicaid. So it's a very personal issue for, a lot of people. Yeah. So let's just kind of dive right into the ballot initiative. So what exactly, when someone signs this packet, what are they signing and what would the ballot initiative actually do?
Yeah, that's a great question. So because there's a lot of history with Medicaid expansion in Utah, we do get a lot of questions about what version is this? What is this? Mm-hmm. So this is really simply put, this is a traditional Medicaid expansion to 138% of the federal poverty level. So all Utahns who are earning below, so for example, a single adult without children, they could earn up to $1,000 a month and they would qualify for this program. Mm-hmm. Right now, there's really not that many benefits or adequate healthcare benefits available to them if they're a single adult without children earning under $1,000 a month. For parents, we do offer Medicaid to parents if they are extremely low income. Mm-hmm. So if their income is between $0 and $1,100 a month for a family of 4, they can qualify for Medicaid. But as soon as their income goes above $1,100 a month, then they fall into this gap. So it's really about making sure there's continuous coverage available to these individuals, that there's no perverse incentives to not accept a raise, to not get a new job that increases your income, and to do what's right for your family. So it's a traditional Medicaid benefit that would be available, and we also have to come up with 10% of the cost as the state. And in the past, we had done that through a hospital assessment, state budget, but through this, we just decided, let's do a state sales tax on all non-food items. It's very simple, very clean. We tried to make it a non-regressive, so that way, people who would benefit from this hopefully are not having to struggle to pay for that sales tax on non-food items. And that would equate to about 3 cents on every $20. So if you think of 2 movie tickets, then you might see an increase of 3 cents. So that's what people are signing on to. It's about 100,000 lives at the cost of 3 cents on $20.
Yeah, 100,000 lives in Utah. That's remarkable that we have 100,000 people who are in that gap right now. And having friends and having family who are kind of in that scenario that you just laid out, and especially if it's a kind of a contractor family where, income can fluctuate from month to month. Yeah. If you're right on that line and you have kids, there's got to be a lot of, worry about whether or not you're going to have healthcare coverage month to month.
Absolutely.
And that's terrifying. So this is a full Medicaid expansion. Now, in the past, what was the Healthy Utah? So we had when can you give us a background on Healthy Utah and exactly what that was?
Yeah, so Healthy Utah was the governor's version of Medicaid expansion. It would have expanded coverage to the exact same population that we are proposing to cover under this ballot initiative. The only difference really was that his bill would have used the Medicaid dollars that would come back to the state of Utah to offer the benefit through the private health insurance marketplace. It's been a while since I've talked about it. Sorry. So it would have expanded Medicaid essentially, but used private health insurance as opposed to Medicaid. So it would have brought back all of the bring back through this initiative, and it would have covered the exact same population, but it would have done it through private market instead of Medicaid.
Okay, cool. Now, the rumor is, and it's all there, but the rumor is that the legislature is eyeing this as one of the 2 ballot initiatives that they are maybe not necessarily targeting, but they're talking about the issue because of the ballot initiatives. So it's this one and the school funding, Our Schools Now ballot initiative. So I know that the legislation isn't necessarily what you're looking at, but do you know anything about the current legislation? How is it different from the ballot initiative? Why do people support it? Why do legislators support it? Why are they talking about it now? Stuff like that. Do you know anything about it?
Yeah, so, preferentially, we're kind of just seeing what it is. But I have to tell you, the only thing that would be acceptable for us is what we're proposing in our ballot initiative. We've worked on this for 5 years. The legislature has had their chance, and they've come close several times to doing what's right. But everything that we're hearing so far is that they're not covering the full nut. They're not going all the way up to 138% of the poverty level. So unless they're willing to go down this road with us and do it this way, then we're going to keep collecting signatures. They've had their chance, and we're going to make sure the people of Utah have the right to vote on the full Medicaid expansion bill.
Yeah. And I assume people are asking you, I thought we had already expanded Medicaid. Yeah. So what is the story behind that?
Oh, it's been so fun. You're asking great questions. So, the Utah legislature, I do have to give them, a congratulatory remark, because for the first time ever, Utah did expand Medicaid and accept federal dollars back to the state to cover single adults without children. That was really a big step forward. However, that only is covering about 500 individuals right now. We're talking about 100,000 individuals. So I think it's a great first step, but we still have a lot of people who are working 1 or 2 jobs. They're going to school. They're caretakers for family members. That Medicaid extension that did happen, it's leaving them still behind. And so what we're proposing would cover all of those individuals.
And the income requirements for that are pretty,
Can't earn more than $50 a year.
so that's 50. 50. You cannot earn more than $50, more than $50 a year in order to qualify for that.
Right, and you have to also have gone through some, a jail or prison system, undergone substance use or mental health treatment. So there's other stipulations as well, and it really was to help with the Operation Rio Grande, initiative that, as well as the justice reinvestment. But at the end of the day, I mean, you even heard it with Chief Justice Durant at the opening remarks of the legislative session, we still need more Medicaid funding because it helps with the treatment of substance use and mental health when you look at this population. Mm-hmm. So even what they did pass, they're still coming back year after year asking for more Medicaid coverage.
So it feels kind of like, and this could be total conjecture, but it feels a little bit to me like we're kind of having to work really hard to get, I mean, it's not peanuts because 500 lives is 500 lives, absolutely, right? Or 400 lives, but it feels like we keep trying to, or you keep trying to, because this is kind of your life's work, trying to get all of these people covered, and every time you go and work for it, it's just a smaller population, and you need to keep working to help all these people in Utah who really need the. And now, of course, with the opioid crisis, I mean, it's even, like you said, it's even more intense.
Yeah, and that's a really good point. All of us are very committed to the work that we do, and we have had polling that is dated back to 2014 about Utah voters, where do they stand on this issue? They've always been at least 60% supportive of expanding Medicaid. So that's why we just felt we needed to do this to give Utah voters the actual chance to vote on it. Mm-hmm. And so that's our prerogative. That's why we're going to continue to do this work. Mm-hmm.
So now you don't have to answer this next question, but it's kind of funny to me. Are you yourself frustrated with basically the lack of response from the legislature?
I have to say, it has definitely been a learning experience for me. I have grown a lot through my work doing this, but I think how I would rather answer that is that I am so happy and honored to live in a state where we have an outlet when something doesn't get done, mm-hmm. right? I don't think that ballot initiatives are a great place to start, but if you are not getting the response that you want from the Utah legislature, this is why it is constitutionally protected in the state.
Yeah, it's pretty actually remarkable when you put it that way, I mean, think about the history of the world and, how much voice, the average citizens got. I mean, this is pretty remarkable that we have 6 ballot initiatives. Yeah. Can you just tell us briefly, last week we had Better Boundaries on. We talked mm-hmm. about gerrymandering and, another ballot initiative. But can you tell us basically what the steps are that you have to take in order to get a ballot initiative on the ballot?
Yeah, so we had to file with the Lieutenant Governor's office. We had to hold 7 public hearings, which you can find those recordings and our presentation on our website, utahdecides.org. Now we are in the signature collection period, so we have all of the ballot initiatives have the same deadline and the same goal, which is April 16th, 2018. We have to have turned in 113,143 signatures. That totals
that last 3 pushes it over.
Yes, I know, it really does. So that number is not made up out of the air. It's 10% of the total of all votes cast in the last presidential election. So that's how that number is come up with, and we have to meet certain thresholds that equate to that number in 26 of 29 Senate districts. So all of us are out currently collecting across the state of Utah. Mm-hmm. Again, ours is the bright green packet. If you have not signed it yet, please look for it. And there's several packet locations too. The People's Health Clinic in Park City, Community Health Connect in Provo, Utah Health Policy Project, AARP, Voices for Utah Children here locally. Those are all places where if you want to seek out a packet, they have them on hand for you to sign.
Cool. And then, I was going to ask you a question. So if this passes, what happens? First of all, could the legislature, if they wanted to, undercut this in some way once it passes?
Mm-hmm.
Yeah, go ahead.
So, since we're not a ballot heavy state, a lot of people do ask us, well, is this just a message that you're sending? Like, does this actually become law? So I think that's a great place to start. Ballot initiatives hold the same weight in terms of Utah code as if the Utah legislature had passed it. So if we do get on the ballot, so we get our signatures in April, you will see this Medicaid expansion proposal on your ballots in November 2018. And if we get 50% plus one of the vote, so over half of the population supporting this, then this does become law. So this will be implemented. The Department of Health will have until April to get their systems ready to start enrollment, and then people can start enrolling in this program in April of 2019.
Oh, wow.
Yeah.
And is that an open enrollment?
Yeah.
For the Medicaid? It is.
Yep. It shouldn't have. It will not have any type of open closed enrollment. You just go to DWS, you see what you qualify for, and if you're eligible, you'd be able to enroll.
Cool. So can people collect signatures electronically?
No. I was going to say absolutely. Yes, they can help collect signatures. So unfortunately, we do not have the Utah code does not allow for electronic signature gathering. All of the signatures, all 113,000, have to be ink on paper. Yep, and they have to be of registered voters as well. So if you're not registered to vote, please register to vote. So you do have to be a registered voter and ink on pen or ink on paper. Okay.
And there was, I believe, a bill at some point to try and allow for collection. Am I right?
I believe Representative Chavez Hauk ran
one.
Yeah,
that's ringing a bell. Yeah. And that didn't make it. So, okay. So then you have to get the correct number by April 16th, you said?
Yeah.
So that's coming up fairly soon. And then 50% of the voters plus one, and it passes. Okay.
Yep.
To effect next April.
Yep.
Perfect. Okay. So can you just refresh for us again how somebody gets a packet, how people go about getting signatures, who can sign it?
Yeah.
Is it done by county? Is it done by how exactly do we do that?
Yeah. So, our website, of course, www.utahdecides.org, and Utah is spelled out. That's where you can find a lot of this information. You can sign up to get a signature packet. You can find information about where you can pick up a signature packet. Alliance for a Better Utah, I know you guys have volunteered to hand packets out if people inquire about them. So we've got that system set up on our website. Also on Facebook, if you just message us on Facebook and say, I want to help, we'll make sure that you get that information. You don't have to seek it out. In terms of who can collect signatures, you have to be a resident of Utah, at least 18 years old. The signature only counts, as mentioned, if you're a registered voter at the time the county clerk verifies that signature. So sign it if you just promise to register to vote. And then,
by the way, you can do that online.
Yes.
Yeah, you can register to vote online. There, you can do that with the Lieutenant Governor's office, or you can just go to Voterize, which is another great group that registers voters. Sorry, continue.
No, very good. Vote.utah.gov is the Lieutenant Governor's website for that. So, and then you had asked, county by county. So yes, we have to collect these in the Senate districts. So several Senate districts have multiple counties within them. So geographically speaking, it makes sense to keep the packets as close to the county as possible. So yes, if you want a couple packets because you go to Utah County for work half the week, then I do recommend you take 2 packets, one for Salt Lake, one for Utah County. Trust me, we have a lot of packets, and I'm fine with that.
That's great. We went out, so we're downtown, and we went out to Gallivan Square last week or 2 weeks ago, and we had 4 packets with us, and we were collecting signatures. And it was really great. We were, meeting with people. They were at they have a little food truck Thursday.
Yeah.
So we went out there and we collected signatures, and there were 4 of us, like I said, and people kept passing, like, I already signed it. It's like, no, this is a different one. There are many packets this time around. So cool. All right. So can you say your website one more time?
Yep. www.utahdecides.org. And we're also, at Utah Decides on Twitter, or just search for that in Facebook as well, and you can find our Facebook page.
Cool. And you can also reach out if you don't remember any of that information. You can reach out to ABU and we can connect you. And can people donate to your campaign?
Yes, absolutely. So this is not, this is an expensive endeavor. So on our website as well, you can click top right corner to donate to the campaign. However you're willing to commit to volunteer, if it's a volunteer to collect signatures, those are worth their weight in gold. Volunteer signatures help us out so much. If signature gathering is not your thing, that's okay. But maybe consider donating $25 and that will help with the signature collection efforts.
Cool. Good luck.
Yeah, thank you.
So just to wrap it up, thank you, RyLee, again for being with us. And you can follow Alliance for Better Utah on Facebook, Twitter, and Instagram at Better Utah. And you can subscribe to our emails to get updates about the legislative session. Check out our website, betterutah.org, and check out our new page, Better Utah on the Hill. And you can see on there a little bill tracker, and it's got Bill from Schoolhouse Rock. It's very on the nose and clever. So we have the bill tracker is particularly interesting for me. You can see, bills can get really intense and really kind of difficult to break down if you're not used to reading them. So luckily, our policy and advocacy people have done all that work for you, and we've listed bills that we are interested in and that we're supporting, and bills that we oppose. Have a little blurb about them and where they stand in terms of the legislature. So we've already gone over your contact information. Be sure to join us next Wednesday at 12:30 p.m. and we're going to be speaking with community members about anti-discrimination. And remember to click Remind Me to go to get reminders when we go live.
I'll have to do that. Yes. I'm going to do that.
Awesome. Do it. Thank you very much.
Thank you.
Okay. Bye, guys.